to the old things that got you sick in the first place. And the next time, sometimes it's too late. And sometimes the same thing that happened that made it, you know, work for you doesn't happen again because of maybe the fact that you would have worn yourself down so much that the same things don't work anymore. I'm saying this because I'm finding that many of us have arteries and vessels that are congested with fats, with plaque, with all sorts of things traversing the bloodstream. And we continue to practice the same things, even though you would have been told that you got to make these changes or this is not going to happen for you, or this is going to happen to you if you don't make these changes. You know, I don't really understand why you would want to pay to destroy yourself and then you end up having to pay to fix what you've destroyed. So you're paying twice, and sometimes it doesn't work. You know, many of us are having troubles with circulation. We're having trouble with circulation because we have too much fat in our diet. We don't exercise. We use foods that are fried all the time. We get into fast foods that are laden with fats. You know, we eat a lot of breads that are laden with shortening and sugars and all of that. And then we even eat foods from our kitchen that contains fats and AGI, monosodium glutamate AGI cubes, that contribute to your buildup of toxic matter in your system. And you don't want to make the difference. You don't want to make the change, but you want to get better. It doesn't work. It doesn't work. And it is frustrating to see the same people doing the same things all the time. It's frustrating. You know, it becomes very frustrating, and you wonder if people really care. Do they really care? You know? Those of us who are serious about our work, that do our best to make sure that you understand what is wrong, and the other thing is that when we tell you what is wrong, you don't believe that what we tell you is wrong. You know? You have your own philosophies, or someone else told you something, and I'm not diagnosing you. It's your body is telling me what is happening with it. That's how it works. When we connect you, we extract data from you. And the data that we extract is coming from your brain, from your central nervous system, and your body itself. And I'm just revealing what was extracted from you. And you don't believe it until you die, or until you're so sick that you're going to die, and then you say you should have listened, you know? But then it's too late. It's too late. So I made a decision that if you're bad enough, I'm going to refer you to some other place because you don't care. But if you really want to get help and you come and you're serious about doing it, I'll do my best to help you. You know? Because it's like bad name and bad mouth. When you come and you're at the end of the rope and we try to help you and you die, you say, oh, we went by Dr. Haynes, but he didn't do anything. But then you're nearly dead and you come. Some of you are literally making an effort to get yourself better, but you're doing little things that are interfering with the process, and you got to listen and you got to stop them. Because I really want to help you. I really want to see you better. You know, I feel good when I see you better. When you don't get better, I don't feel good. I really don't. And I don't want to tell you I worry about you, which I don't, but I'm concerned that you're not making the sacrifices to get the benefits. And you're spending money for it, and I don't like that. You know? So today I want to encourage you, and I want to plead with you to do your best. If you come to us for help, be serious and be committed to doing your part to help yourself. Because the medicines don't cure you, medicines don't cure you. The medicines only work with a body that is prepared to help itself. The body has to heal itself. That's how it works. It doesn't work no other way. You see? So I plan to do something very soon, and it won't be next week, it'll be the other week. I plan to begin some training, some teaching. And what I want to do is to teach you how your body works. Okay? How your heart works, how your lung works, how your liver works, how your kidney works, what makes it don't work. I'm putting together everything I need to teach you. You know, you're going to go to school, and you're going to be in your homes. You can take notes if you want, but some of it you can practice or remember. We're going to teach you how your main organs work to help your body to be able to be healthy. Right? I've got almost everything I need, and when we come here, we're gonna take calls and everything else after a while, but I want to focus for a few weeks on teaching you how the body works. That way you can understand what happens when you don't do certain things, or when you do certain things, what happens and why. Right? So we go to classes. The next time I'm here live, we're going to go to classes on how the body works. Right? So you could tell everybody, who are interested in knowing that we're going to discuss that, and that way when you become ill, you will have a better understanding as to what is wrong and why it's wrong. Okay? I am not certain that all of you will understand everything we say, or I say, but I'll try very hard to simplify it so that it would make sense to you. I'll try very hard to do that. Okay, we're going to take calls to see who we can help. And good evening.
Good evening, Dr. Hen.
Yes?
Hi. Okay, I have a problem. I'm in suffering like tinglings in my toes, and they seem to tell me it's not lack of circulation, and this has been going on for years.
Do me a favor, turn the volume of your television down a little more, because I'm getting a little feedback, okay?
Okay, thank you. Mm-hmm. Yes, this has been going on for years with me, and I'm 80 years of age.
You don't sound so.
Getting this since I was in maybe in my 50s.
You sound like you're in your 50s.
Since I probably was in my 50s, I think, or even more than that. And I'm still getting it. And I went to quite a few doctors to check my feet, and they said it's not lack of circulation.
Are you having any problems like with diabetes or hypertension or anything?
No, I'm on pills for blood pressure, but I don't know. Sometimes my pressure is so good, so I don't know how the doctor have me on it sometimes. I know my cholesterol is a little high.
Do you take the pills all the time?
It's been pretty good now, but I still take the cholesterol pills, and I take my pressure pills. Right now the pressure is being pretty good, so I had some time to stop it because it was dropping low. And I suffer. My problem is I get lots of falls. If I trip, I don't stop until I fall.
So your balance is off?
My balance is bad. I know that.
You have an unsteady gait.
But I make an appointment to see you, but she give me till in March to get that body scan. But it's all the way down in March, and I was wondering if, if sometimes something early come up, if I can get it, because...
What you can do, and it happens at times, you can call them and let them know that you will be a candidate who will receive a call earlier if it's possible, and they have that happen. Sometimes someone else may have canceled or rescheduled, and they can fit somebody in. So let them give them your name, so you can be one person that they can call in that sort of a situation.
Okay, because I appreciate that as early as possible,
Okay, but what I can say to you is that if you're having the tingling in your toes, is it only in your toes? Is it local just to your toes?
And you know what? So I get to, we got old people call it the Charlie horse.
Yeah, you get cramps.
I get this thing all up the back of my calves, and sometimes I just can't move when I get it,
Well,
it's so bad. And the problem is I had two knee replacements.
So you're mechanical.
I'm mechanical. But I had all these problems before the knee replacement.
All right.
So, I appreciate, if I can get that whole body scan and see what's really going on.
It's actually called disease detection.
Pardon?
It's called disease detection.
Disease detection.
Yeah, where we would extract data from your body, and what we extract is what the body is saying is wrong with it, which is very good. It's accurate, guaranteed in the world, 98%.
98%, yeah.
And it's approved by the FDA, so it's not a toy. It is very, very accurate, and it's very thorough also, very thorough.
Yeah.
What I would say to you though, if you're having the tingling and it's not your circulation, have you checked to see that your blood count is okay?
Yes, all that time. The doctor did all that for me. My blood count was okay. My sugar, everything. He said, I'm good, for my age, But
it is very possible that because you've had problems with circulation, and you have, because your arteries have been narrow, because you've had high cholesterol, okay? It is possible that you may have had still some coagulation in the arteries because they're very small. And we will find all of that out when we do the disease detection. But because of that...
I'm on the phone. But the thing is, I'm a person, I go to exercise sometimes 5 days in the week.
You do better than a whole lot of people.
The elderly people, and we do all kind of different exercises.
So when you exercise, do you feel the tingling still?
Pardon?
When you exercise, do you still feel the tingling sensation?
Oh yes, I still get that, yeah.
Okay, so we may have some damage.
I find too much with my walking now. If I walk too far long, and even if I stand too long, the muscle at the back of my leg and then my toes, then they start all feel funny,
I am almost certain that part of the problem you have has to do with varicose.
Pardon?
Varicose veins.
I have slight varicose veins.
Yeah, I'm almost certain that part of the problem you have has to do with that.
But I had this before I had the varicose veins.
Well, you may not have seen them. You may not have been seeing them all the time because you don't always see them. Okay, it's not always visible, but you may have had that problem, and you probably are still having some restriction.
Yeah.
Right?
So I just hope I can get something early to see you, and then
You can do that. Just call them on Monday morning.
Call her Monday, tell her I spoke to you, and
we want to fast track it.
Thank you very much.
Okay.
You have a blessed weekend.
You too, my dear. You take care.
Bye.
Okay, bye-bye. The other thing that may be wrong there is that you may have some deficiency, which we will find out also. If you have some deficiency in minerals, and then you may have some deficiency in potassium, we may have the reason for the, as we call it, Charlie horse type of thing. Good evening.
Good evening.
Turn the volume of your television down. Okay.
Okay.
Good evening.
I'm 45 years old.
Okay, 45 years young.
Young, old, whatever. But I'm having a problem started like 3 months ago.
Uh-huh.
I can't eat, I couldn't sleep, I'm vomiting, I'm losing weight fast. And I went to the hospital so many times. The last time they sent me to do, the PAM sent me to do tests or some tests. They say my cholesterol was high. They say it's 140, 219.
It was what? 219 over what?
They just said 219 and the normal range
Oh, your
between
cholesterol?
140,
Oh,
200.
the cholesterol was 219.
Yes, and the cholesterol
Okay.
was 219.
Okay.
They said the next thing was high was, I can't pronounce it, it's burnt.
Triglyceride?
And then they put PT.
Okay.
They said 20, and it said 7.18 is the normal range.
Okay, okay.
But
All right.
the thing is, I could understand the cholesterol because even though I eat a lot of steamed foods, I indulge in
Fatty things.
fatty things. Like sometimes I would eat the fatty part off of the chicken that the children leave back. And
What is the concern you have, though?
the concern is that I am spitting 24/7, 48 times, and I'm not pregnant. They said I'm not pregnant.
You're spitting because you're accumulating more saliva in your mouth than normal.
No,
No?
yeah, I don't know why, but
But no, I'm asking you, are you accumulating more saliva in your mouth than normal?
by far,
By far.
I have to have a puppy next to me all day.
So you have an overactive salivary gland.
Pardon me?
You have a salivary gland that's overactive.
Okay.
It's overactive.
What
And
would cause that?
it means that there is a malfunction.
Oh,
There is a
right.
malfunction that
Is
is
there
present.
anything that I did or didn't do make it behaving like that?
How long is happening?
It only started like 3 months ago.
3 months ago.
Yeah.
You may not have done anything knowingly, but what is happening is that the gland itself is not functioning as it should. So you're overproducing saliva.
Okay.
So it needs to be examined to see what caused the malfunction, and then you correct that, because there's nothing will stop you from spitting unless you fix the problem. What caused it?
Okay, okay.
So we have to get to the bottom of it and see what it is. And we can't imagine what that is. We have to find out from your body system where the malfunction is.
So where do I come for that?
Well, you have to call the clinic and schedule a time.
Okay then.
All right? You couldn't fix it at home. Now let me ask you,
Yeah.
do you consume a lot of items that are acid or sour?
Sometimes make tamarind drink, like plum drink, fruit drinks mostly.
Fruit
All the
drinks.
different type of fruits.
Hmm.
I make drink for the kids to take to school, and I would use some of it.
I would suggest that you, in the meantime,
Uh-huh.
cut the acids.
Okay.
You know, stop taking anything with acid, and if you're using any sodas or sweet drink, don't use any.
Okay.
Right? Now, regarding the fats that you consume, I would suggest that, what is your body weight?
Right now,
Are you big or small?
I was big. At that, I 180. I had 160, 165. I think this is the last week. 165. Now I'm like 130, 120.
Okay, so you're within range of your weight.
Yeah, I'm not sure the weight right now because I didn't go back and weigh since.
Sometimes,
But the last weight I was 165.
okay, sometimes when you have a situation like that, what you need to do is to do what we call a detox. To
Pardon me?
cleanse your body system, cleanse your gastrointestinal system
Okay.
from the stomach all the way down.
No.
And when you do that, sometimes it corrects the problem.
How do you do that?
You'll have to get to the clinic.
Okay, okay.
right? But stop using too much of the fried stuff, and don't use any sour in the meantime.
Okay.
All right?
Okay then.
Okay. Thanks.
You're welcome.
Bye bye. Good evening.
Hi, good evening, Doc.
Good evening to you, my friend. How are you doing?
Trying to recuperate here
You trying to recuperate from what?
from what is bothering me. I was there by you this week. I'm trying to find out if I can use pepper. I got some bitters on the table, some wine inside. If I could drink that before eating and use the medication.
I don't think you should use any pepper.
Use any pepper.
Don't use any pepper at the moment. The bitters you have, you can take it.
Red wine in the bitters.
You can take it. You can take it, but how often do you take it?
Only the maybe.
Okay. Yeah, that shouldn't be a problem, but don't use any pepper.
Okay, what about my pressure tablets?
Well, we didn't begin to treat you for your pressure problem.
Okay.
So you would want to continue, but monitor it.
Okay, yeah, well, yes, it's normal.
Because as you correct situations, in many cases you correct a pressure problem.
Oh, yeah, I find it normal. Check this morning.
Right. So you want to kind of monitor that, and if it is normal consistently, then you may want to, just not take the medicine all the time. You might want to skip a dosage and so on, monitor it, and if it's still good, you skip another dose, that kind of thing.
Yes, yeah, I know. I do take that something. And the capsules, the pumpkin seed oil capsule.
You take that for what? Your prostate?
I'll use that to come off of that.
That shouldn't hurt.
Okay.
That shouldn't hurt anything.
Okay, yeah. I was thinking yours, but I forget.
That's okay.
Early morning.
That's all right.
Yeah, I'm trying to,
Try and follow the rules,
Right, yes.
and you'll be fine.
Yeah, no. Right.
Okay?
Yes, yes.
All right. You're welcome. Good evening.
Good evening.
Turn the volume of your television down some more. Hello? I'm hearing you.
Good evening, Dr. Hayes.
Please turn the volume of your television down and
Okay.
listen to your phone.
Yes, Dr. Hayes.
Mm-hmm.
I'm feeling a weakness in my feet, like when it's light.
You feeling a weakness in your feet?
Yes.
Like when you what?
Yeah, like early in the morning when I wake up, most it come on me.
How long this is happening? How old are you, by the way?
I'm 54.
Mm-hmm. And how long this is happening?
This is happening for about 3 months now.
3 months.
Yeah.
Every morning when you get up off your bed, do you feel weakness in your legs?
Yeah, like when not on my 2 feet.
Yes, in your two legs, yeah?
Yeah.
So when you say weakness, what do you mean? You can't stand up on them or what?
Very weak, like when it don't have life, like it's weak, like it feel light.
Mm-hmm. Okay. When you sleep, how do you sleep? On your back, on your side, on your belly, what?
Well, on my back sometimes, on my side.
And you don't cross your legs when you sleep?
No.
Okay. All right. If you're having like a weakness in the leg, in the entire leg, you mean from your thigh all the way down or from your knees down?
From my knees down.
From your knees down. If you're having weakness in your leg, it could be a couple of things. Number one, maybe you're having a problem with circulation. Number one. Number two, maybe you're having a problem with nutrition. Or you may be having a problem with your minerals.
But I use a lot of stuff. All kinds of paraglobin, tonic, all kind of fruit juice. I have those things like sour, some guava, cherry, my own things.
That's okay. That's all right. What you mentioned to me there is all good. However, you may still have a problem with your nutrition, meaning that you may not be getting all of the balanced nutrients you need for the lower extremities. And if you have a problem with minerals, um, then if you stand, you won't be able to like take your weight. The bones are too soft.
Okay.
So we will have to determine if you have an adequate amount of mineral in your body, if you're having enough minerals, or if you're having a problem with actual blood flow. You don't get cramps or so, no numbness or anything.
I went to the doctor and they said my blood count was low. So I tried to build the blood up, but it's the same place.
And have you checked back to see if the blood count came up?
I think it came up just, it counts all right, and I feel better, and it happened back to me again.
So when you took the medicines to build your blood count, you were okay.
Just okay, like for a couple of days, and after that it come back again, yeah.
Yeah, maybe because you're not getting, you probably didn't meet the required amount. Because if you took the medicines and you felt better, it means that maybe the medicines will help, but you probably need to take more. And you need to look at your diet to see if you're getting enough of the medicines that can, or the foods that can convert to hemoglobin. Okay, you may not be getting enough. You got to eat more. Maybe eat more green leafy vegetables. Use more foods that has things like we use Edo, right?
That I use Edo leaves, callaloo, beans, the fine savory peas, those kind of stuff I use.
And it doesn't help.
See my condition, I don't develop weight. I maybe below 100. I don't know why.
The weight is below 100?
Yeah, I think so, or 100 somewhere around there.
It is also possible that you're not getting the nutrition because you may have parasites.
Okay.
We have a lot of people who have parasites and don't know, you know.
Yeah, and that
So-
I'm hungry a whole day. That I can eat whole day,
Well,
day.
that probably tells part of the story. You may be having parasites, and as a result of that, you're not getting the absorption that you need,
Yeah.
right? So we need to investigate to see if indeed that's the case, and then you get rid of the parasites, and then you keep eating how you eat normally, and you'll be fine. I want to believe that you have parasites.
I suspect like because there's so much thing I eat, man. If the other people don't eat so much, the thing holding me can eat and me there like this.
And still you're hungry.
Night time I gotta get up and eat.
All right, you may have worms and other parasites in your system that we can investigate and find and take care of.
Okay. So I should come in to you?
You just call the number and make an appointment because I'm not always there, you know. Just call and get the time and then you come.
Hello, you're ready, yes.
All right, but I suspect that you have parasites. What you can do in the meantime, when you eat your food, chip up some raw garlic.
Yes.
Raw garlic. Chip it up and put it in your food and eat it.
Okay.
Right? Because they can't take sulfur.
Okay.
Okay? Try that in the meantime. All right?
Yes.
Okay then.
Thank
Sure, bye. Yeah, you know, if you keep talking, you will find. Good evening. All right, I'm sorry about that. When you dial a number and it rings, turn the volume of your television down. Good evening.
Yes, good evening, doctor.
Good evening to you.
I'm calling to find out about when you have bitterness in your throat, like you wake up and it's always bitter. I want to know what could be wrong there, because my husband, he gets in this bitterness in his throat, and right now we like him because he gets swinging and he gets in a little headache.
Maybe he's producing too much bile.
Okay.
Too much bile in the system, and he needs to visit a physician or a clinic or somewhere where he can be discovered, and then he can be treated. He may be producing too much of the bile from the gallbladder and the liver,
Yeah.
and it's affecting him.
Okay. All
Right?
right. But other than that, you don't have anything that you could use right now to say, reduce it or so?
At home. what can happen if it happens? No, it happens only when he wakes up in the morning.
Through the day, like it's about it's couple like, but this week here, so it was happening before, and then it stopped, and then it started again.
How late does he eat his dinner?
Sometimes he eats dinner late, 8 o'clock, 9 o'clock.
And go to bed when?
Just after.
Yep, it's not a good thing to do because you're doing several wrong things there. Okay, and I'm quite sure he eats heavy. So what he needs to do is eat heavier in the day when he's active.
Okay.
At night, eat very light, and when you eat, allow at least 1 hour. I said 2 hours before you sleep.
Okay.
Because the food is not coming out of his stomach before he goes to bed.
And then the other thing that he's getting is palpitation.
Yeah, well, if he's eating late, how old is he?
47.
47 years, and he's just having. He's not even. He didn't meet 50 yet.
No, he's having this palpitation. This year he'll be 48. He's having.
He probably has.
Stomach.
He probably has arteries that are narrow.
Okay.
Is he hypertensive or anything? High blood pressure or anything?
Sometimes his blood pressures go high, yes.
You gotta stop using cubes and algae in the food.
Okay.
Number one. Number two, you gotta stop eating so late and going to bed.
All right.
He needs to eat early because what is happening is that as he eats late and go to bed, the food is not digesting and he's not assimilating, and he's absorbing a lot of the fats and everything from the food, and it's getting into his bloodstream and plugging his arteries.
Okay, doctor.
And he has to start walking for exercise.
He walks a lot and he rides a lot.
Okay, well then he needs to change what he does with his foods.
Okay. All right.
Okay?
Yes, all right. Thank you so much.
You're welcome. Good evening.
Hi, Dr. Hayes.
Hi, how are you?
Hi, thanks.
Very good. How can I help you?
A while. Doctor, I don't know if you can give me some advice or I would like have to come and see you. I have a baby. She's 4.5 years. Actually, when she born, she had jaundice. She spent 13 days in Georgetown Hospital. But they say that the jaundice reached to her brain and it slowed her development. That she's a cerebral palsy child.
Oh boy.
So when she was 7 months, she was doing as normal baby, turning over, sitting up, balancing her head and everything. After that, she suddenly started deteriorating, stopping from doing what she normally does. They had referred me to the surgery center. I used to take her there for the therapy and stuff. I did CT scan at Woodland. She was 6 months old, but they didn't show anything for her. At present, she's not walking. She's not talking.
That doesn't sound too good.
Yeah.
And how old is she is?
She's 4.
4 years old.
Yeah, but she responds to you very well, like, you know, in terms of like giving you back voice, right? But the only thing she will give is like dada, daddy. She will call to dada, but she's like, no. And she's not sitting up and so by herself. Like when you hold her with support, she will normally throw her leg.
Doesn't sound too good. And the diagnosis may be correct.
Okay.
There is obviously some problem occurring in the brain.
Okay.
She may also have a problem with the spine.
Okay.
And we may have to, at 4, we don't really begin to do the investigations with the system at 4. We start at 5 years old. But we may need to do an investigation to see where in her brain we have maybe the lack of development.
Okay.
And maybe we can see if there is another problem that is causing it, and then we may also get the diagnosis as to what is really happening with her.
So I should make make an appointment and bring her to you?
You can bring her, but I don't know. I don't know if we can actually do the diagnosis on her at 4. What is her
Okay.
What is her attention span like? Is it short, or does she have a?
She have her lens. She have in the lens, but just she's underweight all the time because she's not really eating nothing much. She just consumes very small quantity of food stuff. She basically uses the porridge.
Maybe you can make the appointment and bring her, and then we can do an assessment,
Okay.
and we can see where we can take it from there.
Okay. All
Yeah,
right. Thank you very much.
You're welcome. Welcome.
Bye-bye.
Bye-bye. Yeah, I don't really like to hear those cases because it's a case that um, the prognosis really doesn't look that good, or it doesn't, it doesn't come out good. But you never know. You just never know. Good evening.
Hello, good evening.
Good evening to you. How are you?
I am fine. I am calling about my mom.
Okay. How is your mom?
She's okay, but she has varicose veins in the leg,
Mm-hmm.
and it developed like an ulcer,
Really?
but it wouldn't heal. We took her all over, and we did different treatments. We even flew her to Trinidad to get it stripped, but the ulcer is still there.
How big is it?
She wouldn't show us.
So you never saw it?
No, she keeps it like wrapped up in bandages.
Well, we need to know what it looks like. Does it pain her? Do you know?
Yes, it does, because we can see it sometimes that it is very painful.
Then it's probably infected. It might be infected because if she's not dressing it properly and it's not getting the right attention, then it's probably infected.
Okay. But does it always comes with like an ulcer? Because
No, it doesn't always come with an ulcer, but ulcers normally occur from different reasons.
okay.
It is called a varicose ulcer, maybe, but it's not necessarily an occurrence that happens because you have varicose veins.
Okay.
But it's called varicose ulcers.
Yes.
So, how old is she?
She is about 70.
70.
Yeah.
Mm-hmm. Maybe she's ashamed of it, of having the condition, and she doesn't want y'all to see how bad it is. But it's not helping her not to have you see it because it probably needs better attention.
But she would go like to her doctor and she would get it dressed and then she would clean it at home like every day. And
But it's not healing. So
it's not healing at all.
obviously, it is not getting the right attention, or maybe the approach is not correct in dealing with it.
Okay.
Most times, what I found was that with ulcers, most ulcers that we were able to help people to overcome had worms inside.
Okay.
Most of them, maybe 90% of them, had worms inside.
Okay.
And if she has worms, it's not going to heal.
Oh.
Yeah, you have to get them out before it heals because they continue to feed right there.
Oh.
Yeah.
But she wouldn't show us. She was like, I don't want nobody screeching or nobody crying, you know.
Well, you may need to get her to us so we can have a look at it and see, what can be done, if anything, and maybe we can guide her properly.
And is this the same number I can call and make an appointment? Or
You call the 231 number.
okay.
They didn't put it up there. Oh, operator, can you please put the clinic number there so that, persons can call it when they need to. It's a 231-6477 is the number.
Thank you very much. I
Okay.
will call. I will make an appointment.
Okay, there's a number up there.
And I
Okay?
will get her there.
All right, dear.
Thank you. Have
You're
a good
welcome.
night.
Okay, you too. Bye-bye. Okay. Good evening. Good evening.
Hello, Dr. Hayes. Good evening.
Good evening to you.
I'm calling in connection with my father-in-law. He's not walking. I don't know if there's any advice that you can give me. We take him to many doctors. One doctor suspected Parkinson's, but he gets so many injections and there is no help. He's not walking. He's just like, you have to ice him, you have to move him, you have to push him. He cannot walk at all. And I don't think that he's weak. So I don't know if there's any advice or if we can bring him. I don't know.
Well, you just stop walking just like that?
Yes, just like that. He started like a little bit not walking, then a little bit more and more. And today he's not walking at all. He's using Pampers. We have to take him to the toilet. We have to take him to do everything that he has to do. He's 70 years old. I can't understand. One doctor suggested Parkinson, but he's not doing anything that Parkinson's patient do because he has no pain. No pain at all he has.
Does he have any involuntary
So
movement?
I don't know if you can advise me or I don't know. He's eating well, but he's not walking. He cannot walk at all. We have to just like ice him. Just give him support to move. He cannot walk at all. So I don't know.
It just doesn't happen overnight like that.
No, it started like in last February, but he was walking, but right now he's not walking at all. As I say, he started like, slowly he stopped walking. But he doesn't have no pain, no part of his body is hurting him. And what we notice is that like he's not feeling, he gets injection, he's not feeling. And like the rain would wet him, he's not, realizing that his skin is wet. So I just cannot understand.
Maybe he does have some Parkinson, but it sounds to me that there's more to it than that.
Well, we want to believe that, but we need some help. We don't know where to take because we take him to lots of doctors. But we didn't get no help. The last doctor we went to, he gave him like 10 injections. They say it was like B12, vitamins, the stuff, but no help at all. Instead of getting better, he's getting worse.
Is he talking?
Yes, he's talking.
Is he eating?
He's not walking. That's the main issue. His 2 feet.
Is he eating?
We rub him. We do all sorts of things, but he's not walking at all.
Is he eating? Is he eating? And is he losing weight or?
He's eating well, healthy.
He's not losing weight.
No, he's not losing weight.
Is he small in
He's
size?
not losing no weight.
Is
He's
he
still
small?
the same size, and he's solid, heavy. So I don't know if there's any advice. The only thing that we did not do was an MRI, a scan in his head. That's the only thing we did not do.
His arms are moving.
Yes, his arms are moving. The left hand is not moving as the right one, the left side. But he doesn't have a stroke. He doesn't have a stroke. His left side is not moving as well as the right one. The right one is moving well, but not the left. He moves it, but not so good.
Does he move his legs at all when he lay down or anything?
Move his leg when he lie down. We would tell him to raise it up.
Does he raise it?
Move it, exercise it, but he cannot walk on it.
No, he moves it and everything when he lays down.
Yes, he lie down, he moves it, he raise it up. He would raise it up as high as he can, but just nothing with his feet, no walking.
Maybe he has a maybe he has a problem with the we call a neuromuscular problem, where he developed a problem with the nerve and muscle, and it could have been as a result of an infection.
Okay.
I don't know. You can probably make an appointment and let us take a look and see if we can find what might be wrong with him. But obviously, it is not something that happened overnight. It gradually happened, and it could have been from a virus of some sort that he picked up.
Okay.
So
Do we have to make an appointment before we come, or can we bring him?
no,
like
you
that?
need to make the appointment.
Oh, which number can I use?
The 231 number, the same 231 number.
Okay, Doc. Thank you
so
very much.
He's in a wheelchair, is it?
We have a wheelchair, but we don't use the wheelchair. We would, hide him. We don't take him anywhere except the doctor.
Well, when you bring him in the chair.
Okay, doctor.
Okay?
Yes, doctor.
All right.
Every day you're working?
No, that's where you got to make the appointment.
Okay. Thank you, doctor.
You're welcome. Good evening.
Hello, good night, Dr.
Yes, good night. Turn the volume of your television down a little more. And you have to be brief because I only have a couple of minutes.
Dr. Head, good night.
Good night. I only have 2 minutes. The volume of your television is too loud.
Oh, gosh, I get it.
Too loud of a volume. I didn't do that hang up. Maybe she realized it's too loud. And good evening. Good evening. All right. We have to wrap it up. So I can take 5 minutes more. Okay, all right. Well, I was given 5 minutes more. We got fortunate. Maybe you'll get back to. Good evening.
Good evening, doctor.
Good evening. We got an extra 5 minutes. So
I find that I got a gas problem
you have a lot of gas problems.
from 4 o'clock in the afternoon.
So your gas have a
My
shift.
mom had tell me average was something like 4 o'clock in the afternoon. Up to about 2 o'clock this morning, I had to get up and put on a hot water bath on my stomach and then started.
So your gas is working the night shift.
It looks so, because I've been working night shift for about 25 years, probably. Yes.
Listen, how late do you eat
Back
your
in the
dinner?
afternoon, this thing was so on.
How late are you eating dinner?
It was 6 o'clock.
6 o'clock. And you say it starts about 4 o'clock?
Yes.
Okay. Are you working or are you home?
Well, for 5 months now I'm home.
You're home. Okay. When you take lunch, do you go to bed?
Yes.
How long after you take lunch?
About 15 minutes after.
All right. If you go to bed 50 minutes after you take lunch,
Yeah.
what do you think you're doing to your body? Imagine you just eat, right?
Yes.
And 50 minutes later, you eat heavy, you're going to lay down. What do you think is happening? Let me tell you what is happening.
Indigestion.
Not indigestion. You will get that too. But the food, number one, ferments. You need to have it come out of your stomach before you lay down. If not, it's going to ferment. It's going to form acid. You're going to bloat. You're going to swell up. And then you're going to be a gas chamber. You gotta, when you eat the food, two things you don't do when you eat. When you eat, you don't drink at the same time, and I know you do it. Stop doing that. Because you're sending the food out of your stomach undigested. Secondly, when you eat, allow at least an hour and a half, because you're eating heavy, before you lay down. Let the food come out of your stomach. If you just try those two things, I promise you, you're going to have a lot of relief.
The other thing is I got a regular constipation.
You're going to be constipated because the food...
Jesus, I won't go to the thing on there, so I use Epsom salts.
That is another problem you're
I would
having.
build up the gases.
All right, that contributes to your problem too, because if you're not relieving or removing what is digested that needs to come out, then you're going to be reabsorbing the gases and the toxins into your system, and you're going to be bloating again. So the first thing we have to do is change how you eat and when you eat and when you do what you do when you eat. Secondly, we've got to get you moving. We got to get your bowels moving. We got to keep moving stuff. As you put in, we should be able to get out. Because the food is not, when the food doesn't come out of your system on time, you reabsorb the toxic matter and it creates gases. You understand?
Yes, sir.
So stop eating and drinking. Stop eating and laying down, and let us get you to eat more fibers. Come off of white bread if you're eating white bread. Eat more high fiber or whole wheat breads. Try and find real or better whole wheat bread because a lot of it is not real. But eat less breads. When you have constipation, you need to eat less breads, less flour. Eat more fruits. Use more oats. Understand? Get more fiber in your diet. Use more water. Water will help to move. In the morning when you wake up, 1 or 2 glasses of warm water.
Warm water.
Yes.
I think about over 6 pints of water daily.
But in the morning when you wake up, last thing before you go to bed, 1 glass of warm water. Not right after you eat, of course. And then first thing when you wake up, at least 2. It's going to help with your bowels. Promise you that.
I would still want to come into it.
You can come, but try what I'm suggesting to you. Make an appointment, and then we'll see what else we can do to help you.
Yes, thank you.
Okay?
Yeah.
All right. You sound congested right now. Good evening.
Hi, good evening, Doc.
Good evening to you.
Doc, I got a problem, a urine problem. I just urine like in a 8 hours, sleep 7, 8 times a night. And I went and see a urologist, and he tell me my prostate is enlarged, and he gave me a 2 milligram terocestin tablet. And 1 in the night to sleep, and I still get up like about 3, 4 times in the night.
All right. Once the prostate is enlarged, you're going to have problems with urination. The reason why the prostate is enlarged is what we got to get to. Okay? I don't care what you take. If you don't fix the reason why it's enlarged, it is never going to stay small. It will keep growing all the time.
And when he told me, Doc, that if the tablet didn't help, that he has to go inside there, and the prostate is like a star apple, and he got to scoop it out and then anything.
Like I said, we need to find the reason why the prostate is enlarged and fix that. If not, I don't care what you do, it's not going to make a difference.
Is something serious with that?
It's a problem that needs to be fixed, and it can become serious, yes.
Okay. All right, Doctor, I will make an appointment with you, and I will come over.
Yeah, we can get to it for you. Don't worry. I know what it is, but I can't tell you.
Okay, Doc.
But you can't fix it at home. If not, I will tell you what to do. But listen,
Yes, Doc.
at night, stay away from anything sweet
Yes, Doc.
at night.
Okay.
And before you go to bed, as strange as it might sound, drink 1 glass of water
1 glass of water.
before you go to bed.
Yes, Doc. Thanks.
All right? You try that. And don't use anything sour.
No, I don't use sour, I don't use pepper, Doc.
Okay, but cut the sugars.
Okay, cut out the sugar.
At least for now, okay?
Yes, Doc. Thanks a lot.
All right. You're not diabetic.
No, Doc, no hypertension, no
Okay, all right. Well, it shouldn't be that very difficult to correct, but we got to get to the cause of your enlarged prostate. When we fix that, you're going to be fine.
Okay, I will walk with the result of the
Yes.
testing and come.
Yes, no problem.
Thank you, Doc. Thank you very much.
Welcome. Okay. Good evening.
I want to ask you if I do seed, what treatment you have for it?
It depends on how large it is.
Well, it's about 5 years.
Oh my.
But it's them very big.
It's not very large. Mm-hmm.
Can it be done by medicine? Or you have to get-
There is medicine for hydroseed. We just have to look at maybe the size, and then you've had 5 years, which is kind of long. But in some instances, even with the 5 year, the lesser the year, the time it was present, the quicker it is for it to go down. But we need to see how big, and then we'll decide if we can attempt to reduce it or not. Okay?
that,
Uh-huh.
at the bottom of my tummy working.
The
and
bot-
that picture that I got
You got a hernia?
stones, big stones.
You got
How
stones?
would I get rid of it?
You got stones, and it's the bottom of your tummy?
Yeah, and the back.
Okay, maybe it's bladder stones. Maybe it's stones in your bladder, possibly. Okay? What you can do, what you can start to do is take some lemon and water.
Okay.
Right? Lemon and water. Come off of everything that has to do with acids, like lime, passion fruit, things like that.
Yes.
Don't use any. I normally suggest that you cut your flesh also because you have a lot of uric acid that you absorb when you
I
consume
don't
flesh.
need flesh, really.
Okay, all right. Well, that's good. That's good then.
What works?
Try the lemon and water. Okay?
All right, thanks very much.
You're
What
welcome.
you want to ask me?
Say it again.
Huh?
I didn't hear you.
One more question, doctor.
Quickly.
You
Quickly.
could get pregnant without your menstruation, doctor?
It happens.
If you just get a baby
Yeah.
and the menstruation ain't come yet, then you get pregnant.
It's not very common, but it's possible. Not very common, but possible.
Baby still nursing.
Well, you should have wait.
We sure?
Should have wait.
All right.
If you do things to get pregnant, the chances are you could.
Tell me that.
I know it's not you.
I own
I know it's not you, but I know the person is right there.
question.
Okay?
Yes, doctor.
All right.
Very much, right?
Welcome. Good evening.
Good night, Dr. James.
Good night to you. How are you?
I am fine. I am just calling to find out. I don't know if you can help me out. What is the cause for bad breath?
Bad breath. Several things could be causing bad breath. You have any problem with your gums?
No.
You sure?
Yes.
We are finding that there are lots of people who have bacteria in the gums between the teeth and don't know it.
Okay.
Do you floss?
Pardon me?
Do you floss? You don't know what that is?
No.
All right. You know that thing like a thread that you use to do your teeth, like clean your teeth between your teeth?
No, I don't use that. I used to, but I stopped.
You need to get floss, dental floss,
Yeah.
and get down between the gums.
Okay.
First thing, and you can rinse when you do it, maybe twice a week or so. You rinse with some mouthwash, some Listerine or something like that.
Okay.
Secondly, do you have any cavities in your teeth?
I guess.
You guess. Did you go to a dentist?
No, I supposed to be going anytime.
Because if you have cavities, that can also contribute to the bad breath.
Okay.
Thirdly, it could be coming from your stomach. If your digestive system is not functioning properly and you have things like H. pylori or maybe acid problems or so,
Yes.
gastritis, things like that, hypoplastic gastritis, it's possible that you could have the odor coming from the stomach because the food is not processing out properly.
Okay, so what's the cause for the food not processing properly?
Like I said, you could have a condition they call H. pylori, or you could have problems with your digestive system.
Okay.
Hmm.
And the next question, Dr. Hayes, does it have any after effect with pepper, using a lot of pepper? Because
Of course, if you're using a lot of pepper, you could destroy the stomach walls.
because sometimes I was just using
Why you have to use a lot of pepper? The pepper shouldn't be. You want to avoid as much as possible using things that are hot, either tea, food, or spice, because you could be destroying the flora or the protective coating or lining in the walls of the stomach,
Okay.
and that too can contribute to your bad breath.
Okay, because I find I use a lot of pepper.
So why are you? I mean, why? You just, the food doesn't taste good?
Sometimes, yeah, the food does, but sometimes I don't know. Like every time I eat food, I gotta get this pepper. I don't know why.
Then
But
you then you're contributing to the demise that you have.
okay.
Cut your pepper.
All right. Thank you, Dr. Ian.
You're welcome. All right, we got some time granted to us, so you can call. Take the time when you get it, because you never know. Oh boy, I was trying to take another one, but I said time's up. All right, I want to thank you for participating. I hope we were able to help a lot of you. Remember that we need to be conscious of the fact that we can contribute to our own sicknesses or demise, and you want to let your foods be like medicines and your medicines be like food. All right? And you don't want to dig your grave with your teeth and eat yourself into your grave like many persons are doing. Cut your fats, cut your fried foods. You know, use more steam, broiled, baked things and so. Okay? And make sure your bowels are moving properly, and don't eat and drink at the same time, and don't eat and lie down. It doesn't work. It will hurt you. All right? Dr. Haynes saying good night. God bless you. Have a good weekend. So long.